So the brachial plexus is comprised of the ventral rami of C5, C6, C7, C8, and T1. C5 and C6 come together and form the upper trunk, C7 the middle trunk, C8 and T1 the lower trunk. As at this point, I want to illustrate on Krista, as we have her turn away from me, where the structures are as they leave the neck. So this is your posterior triangle, formed from the sternocleidomastoid. Anteriorly, posteriorly is the upper traps, and then your clavicle. So it's right kind of in the middle lower part of the triangle here. You have two muscles. Most anterior is the anterior scalene muscle, and right in posterior to it is the middle scalene muscle. So the upper trunk is going to come through those two muscles, and then it's going to descend down under the clavicle. At this level, the trunks are going to form anterior and posterior divisions. From the divisions, the anterior division of the upper and middle trunk are going to form the lateral cord. The anterior division from the lower trunk is going to form the medial cord. And the posterior division from all three trunks is going to form the posterior cord. So if we look at potential sites of impingement, one is right here in the posterior triangle, known as the scalene triangle. So these two scalene muscles could be tight, and they could potentially impinge on the brachial plexus as they come through it. Then as it travels down under the clavicle, but above the rib, that's your costoclavicular space. Sometimes that space would be diminished if we have our subject lift their arm all the way overhead, like this, and that could potentially impinge on the brachial plexus, in particular, the divisions. So people that do a lot of overhead work or overhead throwing athletes in particular, they can tend to get the symptoms of injuring the divisions of the brachial plexus. Then from there, it's going to travel down under the pectoralis minor muscle, which is going to go for the coracoid process down to ribs 3 to 5. And that's, again, a potential part of impingement. If we have bad posture, Krista would demonstrate bad posture, forward shoulder position. If it stays in that position for a prolonged period of time, the pec minor can become tight, and that could potentially impinge on the brachial plexus. So, in review, the three potential sites of impingement are A, in the scalene triangle. And also, some people have what's called a cervical rib. That could additionally impinge on the brachial plexus. Site number 2 is the costoclavicular space, and that can be impinged a lot of times with bad posture as well as a lot of overhead type movements. And 3 is underneath the pec minor, which can be impinged with a bad posture and a tight pec minor. So a lot of times stretching can help, stretching the scalene muscles, stretching the pec minor, and improving posture. That can help minimize the risk of impingement of these three sites on the brachial plexus. So this slide shows the course of the brachial plexus and where it can be compressed or impinged along its course, coming down through. First, you see the medial and the anterior scalene muscles, these two muscles right here. And the roots and the trunk that are formed come out through those. Then the brachial plexus is going to come down along with the subclavian artery and the vein that you see right here. So that's your neurovascular bundle. Comes down under the clavicle, as you see here, between the clavicle and the first rib. So that's your costoclavicular space, and that's also a potential site of impingement, especially as you see over here when you do a lot of overhead type work. The space diminishes and you have a higher risk of impingement. So there's two sites. One, again, as it comes through the scalene triangle here, between the anterior medial scalenes, tight scalene muscles could potentially be a cause. And the second one is in the costoclavicular space. And then if you continue it, following it down, it's going to go under the pectoralis minor. And that's a third potential site of compression, a tight pec minor, bad posture, rounded shoulders. All those could potentially cause a problem in the long haul. And then one other thing I might mention here in the scalene triangle is some people have what's called a cervical rib that comes up here from C7 down to T1, and that could potentially impinge on the brachial plexus as well.